Good afternoon, everyone. It's great to be here. I'm Melissa Perry, your moderator for this session of the 2024 National Health Research Forum, Exploring Innovations in Health Systems Research. I'm pleased to be joined this afternoon by Dr. Robert Valdez, the Director of the Agency for Healthcare Research and Quality, or AHRQ. Dr. Valdez has been the Director of AHRQ since 2022. And under his leadership, AHRQ aims to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work with the U.S. Department of Health and Human Services and with other partners to make sure that the evidence is understood and used. Thank you for being here, Dr. Valdez. I'm looking forward to hearing more about the great work you are doing at AHRQ.
Well, thank you, Dr. Perry. It's not just me, but a whole crew of very talented people at AHRQ and across the department, actually, who are moving the unique work that we try to do. But I would be remiss if I didn't first say thank you to Mary Woolley, the Research America Board of Directors, and all of the staff there at Research America who advocate day in and day out for science to improve the health of the American people. You know, for decades, they've been dedicated to really bringing science and evidence to bear on improving the health of the American people. 35 years ago, Congress recognized that there really needed to be three intertwining threads of inquiry in order to make real medical progress. And we're celebrating our 35th anniversary at AHRQ because 35 years ago, Congress elevated the National Center for Health Services Research and Technology Assessment to agency status in order to really bring two of those threads that were missing at the time into real visibility and into action. Of course, the first thread is biomedical research. It's fundamental. But we also needed the technology assessments. And that is what I mean by that is really how you look at new materials or new methodologies or new technology that come from outside of the healthcare field into healthcare for its use. Most people today are talking about artificial intelligence in one way or another, although we've been using artificial intelligence in healthcare since the 1960s. But every new generation, a new tool in artificial intelligence needs to be re-examined and used as it begins to be implemented. The third is really health services research, the applied health services research, looking at evidence in the real world, developing evidence in not necessarily randomized clinical trial areas where validity is high internally, but looking at how those innovations function in the real world where external validity is most important to healthcare executives and clinicians who need the trust of their patients in what they're doing. AHRQ has really had a unique scientific mission over the last 35 years, which is to improve the quality of care that's delivered to the American public by really developing the scientific evidence, synthesizing the findings of research that takes place at NIH, at AHRQ, at CDC, funded by private foundations and others, and synthesizing that into what I like to call actionable knowledge. And then we don't stop there. Our mission is also to disseminate those findings and those innovations and develop tools and resources that can be implemented to improve care that people actually receive and improve the quality of that care. But the Affordable Care Act added on top of what we already had on our plate 35 years ago, a special focus on improving primary care, which is foundational to a strong healthcare system. And so given the slim margins in the healthcare industry, AHRQ serves as the federal R&D arm of the healthcare industry for a large part. Now, producing high quality care requires healthcare systems and clinicians really to provide patient-centered, safe, effective, and timely care that's that's efficiently and equitably distributed, as you described earlier. But the applied nature of health services research and the resources that we produce to improve the quality of care are used by healthcare systems and clinicians in the United States and also worldwide. For example, we developed a toolbox called Team Steps some years ago that's been used to optimize team performance in healthcare delivery settings, both here in the United States, but also worldwide. We've developed a tool set called Candor. That's a toolkit that healthcare organizations and clinicians can use to respond to unexpected events that cause patient harm. In fact, today is the World Patient Safety Day. And so AHRQ co-chairs the National Action Plan Steering Committee and coordinates on behalf of the department the National Action Alliance for Patient and Workforce Safety, a learning community of patient safety advocates, healthcare systems executives and clinicians, federal departments, and of course, many of the agencies across the Department of Health and Human Services to implement evidence-based strategies to reduce patient and workforce harm.
Well, happy National Healthcare Patient Safety Day. It's auspicious that you're here with us today. It sounds like the fact that you're marking 35 years anniversary has been a time of retrospection and also an opportunity to look ahead. I know that AHRQ just announced a historic funding opportunity related to state-based healthcare extension cooperatives. Tell us more about it.
Well, as you know, in our previous conversations, you know, I think all healthcare is local. And I think the current controversies in care delivery make it more visible that it's really the states that regulate and control how healthcare is organized and delivered in their communities. And so with that recognition, under the Patient-Centered Outcomes Research Trust Fund, AHRQ is charged with disseminating and helping healthcare systems and clinicians implement what I was previously calling actionable knowledge. That's the result of patient-centered outcomes research. So in partnership with PCORI and NIH and others who do that research, we then turn that information into actionable knowledge. The unfortunate part is that we know that the innovations and that new knowledge takes such a long time to get from the research environment into clinical practice. And so the extension services, which are built on the concept of the agricultural extension service, is really a way of reducing the time from innovation to actual practice, in which those innovations become part of the mainstream of medical care. That is bringing 21st century healthcare to those who need it most, more rapidly and more efficiently. It's an infrastructure in order to bring the scientific advances that we make into the clinic and into the hospitals. It's a way in which we can also understand what's of most importance to those communities. So we won't be driving what they're doing. They'll be choosing what they want to do, because the healthcare extension service is built around the notion of a collaborative effort at the state level that addresses a number of the issues that often get in the way of those innovations coming into practice. That's fragmentation in the care delivery system, which our healthcare systems all around the country are famous for. The misaligned financial incentives for actually providing high quality care or introducing new approaches. And also the technical assistance that's often needed to change workflows, to deal with issues around how those innovations can be worked into the actual day-to-day operations of a community. This collaborative approach is really, I believe, been well tested in other work that we've done at AHRQ, particularly in the primary care areas. And so we look forward to working with the states to really begin to make 21st century care, as I said, available to everyone in our nation.
That sounds innovative. It sounds needed. It sounds exciting. It looks like you're looking to sense of place and location and also variety and innovation coming from various states. Can you give us a preview of some of the outcomes you're hoping for based on this new initiative?
Well, my definition of success is really that the most vulnerable in the states who receive state-of-the-art care in a timely and efficient and equitable way is met. Yeah, and that is really what I was saying before, making 21st century care available to all of those who could benefit most from our nation's vast investments in science. And you know, it's really an opportunity also to think about how, as I said to my staff when I took on the helm at AHRQ, how do we begin to plant the seeds for providing high quality 24th century care? Because right now we're at a crossroads in American healthcare. We have a real crisis in the American healthcare systems across the nation. And we have an opportunity because of generative AI, because of new advances, and because of the great greater understanding for the underpinnings of the disease processes and interventions that are available to really make some real headway in our healthcare systems. The cooperatives themselves are intended to try to bring that kind of technical expertise to bear that because healthcare systems operate on such limited margins, they really can't afford to do the R&D and the innovation work themselves.
Having that kind of insight will be absolutely essential to all of the dedicated providers around the country and all the folks that are so deeply invested in health systems and robust, accessible health systems. Our time is running short, so before we close out, I have one more question for you, and that is, what kind of message would you like to give our audience, the research advocates that are always working toward greater attention and ensuring that there's greater investment in these kinds of critical initiatives in healthcare?
Well, we must listen to our customers first because they will drive quality improvement. And we cannot ignore our nation's healthcare crisis any longer. The pandemic has laid bare all of the deficiencies that exist. But the positive side is that we actually have a lot of evidence-based strategies to make it better. And we must invest in the applied science that's necessary to address our crumbling healthcare systems and improve the quality of care that's provided through them. In partnership with our patients and our clinicians, we must regain the trust of the American public in their healthcare systems, which we've seen decline precipitously over the last couple of years. And we can only do that in partnership with our customers and with our healthcare systems leadership. We've been able to do part of that by recognizing that while we're in search for cures, we can actually improve care. We launched a network of long COVID care network that is providing the kinds of evidence that's necessary to deal with the millions of people who suffer from long COVID. We've been engaged in implementing the National Action Plan for Patient Safety and Workforce Safety that has developed great momentum, and we've now reduced the rise in patient safety events back to pre-pandemic levels, and we hope to cut in half from the peak time by 2026 patient safety issues. But patient safety doesn't exist until everybody is safe. So our work is not done, and we've got a lot to do, and we look forward to doing it with patient advocates, with healthcare systems leaders, and with the research community who can develop the kinds of innovations that are necessary to create that evidence-based strategy to make healthcare the best possible that Americans can get.
It's been so valuable to hear these perspectives from you today, Dr. Valdez. I've really enjoyed this conversation. And to the members of our audience, thanks so much for joining us today, for tuning in, for being committed to this important work. I wanted to call your attention to the next session of today's programming, Strengthening the STEM Workforce for a Competitive Future. You can access this session in the lobby of the Zoom events platform. I hope you all enjoy the rest of the 2024 National Health Research Forum. And thanks, everybody. Have a great day.
Thank you so much.